There is now a danger that has become a threat to us all. It is a deadly disease and there is no known cure. The virus can be passed during sexual intercourse with an infected person. Anyone can get it, man or woman. So far, it's been confined to small groups, but it's spreading. So protect yourself. And read this leaflet when it arrives. If you ignore AIDS, it could be the death of you. So don't die of ignorance.
This used to be the face of HIV and AIDS, along with multiple other campaigns in the late 1980s. And the stigma this spread still exists today, particularly within the LGBT community. I'm a young person from Dundee, and I've been working with Terence Higgins Trust Scotland to explore this issue. And now with HIV being a manageable condition and not the death sentence it once was, we've also looked at how and why people are still contracting it, how their sexual practices are being influenced, and how we can better educate people about testing and safe sex, to remove some of the stigma and fear still lingering from years ago.
There's been a stigma around for HIV for years, and it's always really been seen as a gay disease which spreads through the gays.
I would say there is still a bit of a stigma. It's still a scary word. As soon as you say it, people kind of tend to react quite extremely about it.
My first thoughts when I think of the words like HIV, I think is like a lot of things that people fear, especially gay guys, that if they pick it up, then it's going to be like sort of the end sort of thing.
Being queer makes you an outside in society anyway. If you've got HIV, even though it is quite prevalent in the community, you're an outcast even from the outcasts almost.
I think when I came out myself, I remember like one of my parents worried that I was going to catch HIV just with it being such a stereotype.
I think there's still lots of misconceptions about HIV in the community, particularly that HIV is still, in some populations, regarded as a death sentence, and a lot of people don't realise that actually it's just another long-term manageable condition.
Well, when it comes up in conversation, it's always it's a difficult subject to talk about.
Although it may be difficult, it's a conversation that needs to be had, with over 4,500 people in Scotland now living with the condition, with around 400 of those in Tayside alone, and many more undiagnosed. We were keen to speak to members of the public to get their views on HIV.
Scary.
My initial thought is AIDS. That's my next thinking.
People see it as like a really sort of evil thing.
When people say HIV, you automatically think AIDS and death. Not going to lie, I mean, it sounds pretty traumatic and very over-exaggerated, but it's just what comes into my head when it's mentioned.
Yeah, I do remember the campaigns from the 80s, and I don't really like to say it because it wasn't very good. It was against homosexuality.
You know, there's a lot more better treatments now. People are living a lot longer with HIV, but I think there's still a big issue with stigma. Yeah.
The treatment's come a long way, and I think perhaps because of that, we no longer associate people who are HIV positive with a death sentence. But the flip side of that is it could lead to a lot more reckless or unsafe behaviour.
With a wide variety of mobile apps now available to arrange so-called hookups, it's easier than ever for anyone to engage in such risky sexual behaviour, which often consists of meeting relative strangers for sex, including going to their home and meeting in public sex environments, with no real knowledge of who you're going to meet.
And I think, although you can't tar all men who have sex with men with the same brush, there is that conception within communities sometimes that this is how gay men meet for sex, and that puts them at more risk, and therefore they're putting others at risk that they have sex with. And I think guys can make a lot of rash decisions sometimes and not think about it fully before they go into it, and not think about their own health.
You kind of forget. You don't know anything about them. There's also the excitement in that of it, you know, because it's kind of illicit, it's taboo sort of idea.
I think when gay men are forming sexual relationships, the they're too trusting of their partner. If their partner tells them they're fine or that they've been checked recently, they're quite willing to not wear a condom and have unprotected sex, regardless of knowing the person or actually having evidence of their sexual health history.
Unprotected or bareback sex is on the rise, and this in part could be due to the rise in bareback and condomless gay porn. One porn producer openly stated that he doesn't use condoms with his HIV-positive partner, and that condomless scenes are far more popular than scenes with condoms. Indeed, one porn studio released a film called Viral Loads, featuring a jar of HIV-positive semen, which is then inserted into a performer's rectum, which highlights the trend of so-called bug chasing, or being given the gift of HIV. But how much influence does porn actually have? Well, a study found that if you like bareback porn, you're likely having bareback sex, with participants who said that 75% or more of the porn they watched was bareback, were 8 times as likely to engage in bareback sex as those who did not watch porn or watch condom-only porn. Another survey found that 94% of its respondents were more likely to have unprotected sex with a stranger if he was good looking. Barebacking is now becoming its own community, where it's claimed you can be free and not be judged by the status that you have. And although this is of course a very important message, there are also other messages, such as condoms are for pussies, being touted by HIV-positive performers. So it's no surprise that some may take a lax attitude towards HIV and using protection.
And we need to talk about porn. We need to have that as one of the main things that we talk about in sexual health, relationships and parenthood education. We can't just ignore it and think that it doesn't happen. We need to educate young people about it. And I think a lot of people are probably scared to do that.
There was one experience very early on in my coming out phase where I'd been seeing this one guy on and off occasionally, and he started getting rather pushy about not using protection anymore.
I think people that aren't as worried now is about the health side of it. They know that they can take pills and they know that they can potentially live a long, healthy life.
I've heard some young people talking about that, HIV, you can be cured for it now, and I'm like, no, you can't. Like, it's still quite it's a big thing, and it'll affect your life if you catch it.
I can definitely appreciate how it's not as terrifying as it used to be, but there's still room to be worried about it, definitely. Maybe a little more than we are nowadays.
Yeah, I mean, it's really hard to educate people around HIV because you don't want to scaremonger people into using protection, because then that breeds the stigma and discrimination that we've seen, such as a result from the Don't Die of Ignorance campaign in the 80s. But also you want to educate people so that they're aware of HIV and that's on their radar, and they're aware of the risks that they might be taking and what consequences that might have.
This could be achieved by more effective sexual education in schools around HIV, particularly within LGBT relationships.
I think they should have far more education on LGBT relationships in schools, which it only just seems to be like sex ed is for heterosexual couples, which needs to be changed, I would say.
6 to 10% of the population, of the school population is gay. So the 6 to 10% of the population who get no education on how to be safe, what risks they might encounter.
I think there needs to be an approach where it's not seen as simply in the hands of the school. It's got to be a more kind of universal approach with health professionals, with families.
The whole sex education programme needs to be revamped, and while you're doing it, add in the LGBT side to it.
Including LGBT in the sexual education programme would not only reduce stigma and misinformation around HIV, but allow people to be more open about their sexual practice and being safe, and also raise awareness of support services such as All Sorts and Men Only Tayside, so people know where and how to get tested, and the fear and stigma of doing so can be reduced.
I think there is definitely a massive stigma around HIV testing. If there wasn't, there wouldn't be around 22,000 people in the UK today that are undiagnosed living with HIV.
It's a very worrying thing to go and do, and I'd be lying if I said it wasn't a small factor in why I haven't gone yet.
You do it and then you're waiting for the results and you're kind of sitting there going, oh no, what if it's bad? You know, there's a fear that even if you think you've taken all the precautions in the world, you're still worried that something's going to turn up that you didn't take into account.
And I think that may be because so much pressure is put on gay men about HIV and the kind of stigma that's associated with it.
When did you last get tested? I don't think that should be such a scary question. It could be like, when did you last go to the dentist? When did you last fly a plane? I mean, it should be simple.
The process of getting tested itself is very simple, and it's free, quick and easy, with rapid HIV testing now available. It's carried out in a safe environment where you can be open about your sexual practice without the fear of being judged.
Yeah, I think they're very friendly and they're there to help you. Like, these people are judgment-free, like they're very open-minded and they're only there to do their job, but at the same time as well offer that support for you.
If you're protection and you go to the clinic and get checked up, everything should be fine, and it's a pleasurable experience for you, your partner. It's a mutual thing that you'll both enjoy, and that's always overlooked, and that should be taught in schools and more given out information that sex is fun. It's not just for making babies.
This one time, met up with a guy at club, seemed things great, went back to his place, things were grand. And he came out with this pair of condoms, and I'm like, what's that? He's like, these are glow in the dark. And I just look at them going, there's so much fun we could have here. Moments pass, and then appears that we've given up entirely on having any sort of, romantic moment going on, and are now just sort of sword fighting with the glow-in-the-dark condoms on and making lightsaber noises.
They don't teach you that sex can be fun, sex can be exciting, sex can be the greatest thing in the world when you're doing it right and when it's with the right person. They don't teach you that one of the best things in sex isn't actually the sex. The best thing is, this is going to make me sound really gay, but it's the part afterwards where you lie down and you're spooning your partner and you say how much you love each other and then you're cuddling. That's the best part of sex. No one ever taught me that.
I think it's really important to promote that sex is part of life and that people should enjoy it. They should just be safe while they're doing it. And they'll probably enjoy it more if they know they're not putting themselves at risk.
So it's about guys being aware of that and understanding that everyone gets horny sometimes and everyone just wants to have sex, but as long as you're doing it safely and you have access to condoms and lube and the information and advice you need, like the Men Only Tayside website and like the information that's on Terence Higgins Trust's website and other leaflets and forms of information, I think if guys are equipped with those resources, it makes it somewhat better for them.
Being informed, aware of risks, and where to access support will allow people to talk openly about sex and LGBT relationships, and hopefully allow people to have a safe and overall fun sex life without the fear and misunderstanding of HIV that has long cast a shadow over the LGBT community.